Hello, my name is Debbie Pesca, and in this presentation I will be going over the practice management of comprehensive medication management, or CMM. So the objectives of this presentation are to define the framework for CMM practice management, and then explain the purpose and use of the CMM practice management assessment tool. As a reminder, there are three components of CMM: the philosophy of practice, the patient care process, and practice management. And significant attention has been given to developing a consistent patient care process for providing CMM. However, previously little was known about what was needed to effectively manage a CMM practice. There are resources on how to build a CMM practice, but the specific pieces of CMM practice management had not been defined, which is important because while a consistent patient care process is essential for ensuring standardization of CMM across pharmacists, practice management is necessary to replicate, grow, and sustain CMM practices. So that's what we're going to be talking about today. Specifically, I define CMM practice management as all of the necessary resources and support to provide CMM in an efficient and productive manner. My PhD dissertation studied this topic of practice management, and by conducting focus groups with CMM managers and doing interviews with pharmacists working in over 30 primary care clinics across the country, I developed this framework for practice management. So CMM practice management is comprised of 5 domains: care team engagement, CMM program evaluation, care delivery processes, organizational support, and ensuring consistent and quality care. And each of these domains is then made up of essential components. So starting with care team engagement, there are 3 essential components of this domain: presence and scope of collaborative practice agreements, or CPAs, interprofessional collaboration, and availability and use of support staff. And each of these components are multifaceted. So presence and scope of collaborative practice agreements include medications and whether pharmacists have the ability to adjust dosing of existing medications, the ability to initiate or discontinue medications, and whether pharmacists can order labs, durable medical equipment, and imaging. Next is interprofessional collaboration, and that includes communication with providers. So is there a consistent strategy for contacting providers with CMM recommendations and ensuring recommendations are followed through? Some clinics do collaborative visits where the patient might see the pharmacist first and then see the primary care provider immediately after. So if this occurs, is there a defined workflow in place and defined roles that articulate which member of the care team is responsible for executing various parts of the CMM care plan? Also included in interprofessional collaboration is organizational presence. So are CMM pharmacists consistently invited to attend clinic meetings? Is there a non-pharmacist champion of CMM? All of these factors make up interprofessional collaboration. Then there is availability and use of support staff. So is there support staff available to assist with scheduling CMM encounters, help with rooming, taking vitals, billing and coding, point of care testing? And then do pharmacists have a dedicated support person, or do they have someone that is shared with the rest of the care team? The next domain is program evaluation, and the first essential component is measuring CMM program data, which can include many things. For example, the identification and resolution of medication therapy problems, clinical markers such as ACT scores, blood pressure, A1C, fiscal measures such as revenue generated and estimated cost savings, and descriptive measures including payer mix, number of medications patients are taking, etc., pharmacist productivity, and many others. Next is reporting results. So to whom is the data reported? Is it just within the CMM team, within the clinic, across the organization? Does data need to be manually extracted? Is it possible to extract aggregate and patient level data? And then the timeliness in which IT can complete CMM IT requests all fall within this. Moving into care delivery processes, there are various ways to identify patients for CMM. The pharmacist may be responsible for identifying most patients. There could be an automated algorithm that identifies patients in highest need, or referrals could come from non-providers such as desk staff or community pharmacies, payers, or generated quality care lists. Lastly, another important thing is whether the EHR allows CMM empanelment. Then there's scheduling CMM visits and whether the EHR enables CMM scheduling, if there is a referral system for CMM in place within the EHR, and if there are automatic appointment reminders generated for patients for CMM or to ensure patients complete recommended follow-up visits. Finally, systems for care documentation. This means, do pharmacists document CMM visits within an EHR that the rest of the care team uses? Are pharmacists documenting all components in one system so that there's no double documentation? Are there certain EHR tools that facilitate documentation efficiency or resources for inputting notes such as Dragon or having scribes available, which also contribute to efficiency? And then whether documentation requires a provider co-signature, and then if there is a documentation review process in place to identify areas for improvement on a regular basis. Then we move on to organization support. So starting with leadership support, that includes the different levels of support CMM receives from leadership across the organization. So clinical pharmacy manager support, if there is a clinical pharmacy manager, clinic leadership support, and executive leadership support. This also includes the ways leadership supports CMM, such as advocating for their presence in provider meetings, encouraging use among other care team members of CMM services, etc. Availability and adequacy of clinic space includes availability of patient care space and non-patient care space. So is the pharmacist's non-patient care space accessible to other members of the healthcare team? Do they have designated exam rooms? And then other factors such as the privacy and size of the space, as well as whether or not they have necessary care space equipment. And then billing and revenue includes all the various ways pharmacists seek revenue for CMM services. This could include billing fee-for-service off non-pharmacy mechanisms like Medicare annual wellness visits or Incident to billing, billing fee-for-service through pharmacy mechanisms like MTM CPT codes, or engaging in value-based payment. Then the last domain is ensuring consistent and quality care. Included in this is quality assurance processes. So is there a consistent process to ensuring pharmacists are providing consistent and quality care? And is there a process for ensuring notes have met documentation requirements such as chart audits? And then are data from the QA processes being used to inform CMM improvement activities? Finally, there's practitioner training, which includes whether there's a standard process for training newly hired CMM pharmacists on these components of CMM, the philosophy of practice, patient care process, and practice management. Whether there is a consistent trainer, and then if there are ongoing clinical development initiatives, and if there is a policy, procedure, and standards of practice retraining on a consistent basis. So as I said, each of these components is multifaceted. So if we just look again at the presence and scope of CPAs, we see that it's made up of the ability to adjust dosing of existing medications, the ability to initiate or discontinue medications, and whether a pharmacist can order labs, durable medical equipment, and imaging. And so what I did is I took this information that I gathered from these focus groups and interviews to create a practice assessment tool that pharmacists could use to assess their own practice management. So this here looks just at the collaborative practice agreement section of the tool. And you can see that all the things that were listed previously are listed here on the left. So the medications, whether or not they can adjust dosing, initiate or discontinue labs, durable medical equipment, and imaging. And then all of the response options are listed from left to right in terms of less optimal to optimal. So if we just focus in on labs, we can see that the least optimal would be that pharmacists cannot order any lab monitoring. And then most optimal would be that pharmacists can order lab monitoring without provider approval under their CPA. This is another section of the tool, the billing and revenue section. And all of these response options stem from things that the pharmacists and CMM managers stated during the focus groups and interviews. So for example, if we just look at this first box here, this response option came out of somebody saying, we started doing annual wellness visits because of the reimbursement model. It provided a financial revenue generator for us. And somebody else had stated, our pharmacists are involved in co-visits or group visits, and because of our contribution to those visits with the physician may up-level the coding. Another pharmacist had pointed out, all of our billing is done through MTM CPT codes. And then a manager had stated, we don't bill for any of our services. We provide justification through cost savings rather than billing. And so I think that all these response options really just show the spectrum of practice management that exists across CMM practices. So the final tool that came out of this work is the Comprehensive Medication Management Practice Management Assessment Tool. It's a 78-item descriptive tool that's meant to be filled out by an individual practice site to identify potential areas for practice management improvement. This is a quote from one of the pharmacists that was interviewed during the study. She said, "It's hard when you don't know what you don't know. I don't know what people are doing at other clinics. I don't have that global experience to know what I could be doing better or how other people do it better." I think this quote really highlights the need for more closely examining practice management. This practice management framework and tool can now give pharmacists a better understanding of their practice management and provide direction of areas where they can improve so that CMM can be provided more efficiently and effectively. As a final exercise of this presentation, I would highly encourage you to complete the CMM Practice Management Assessment Tool to evaluate where your practice falls on the spectrum of practice management. This will help you to identify areas of improvement to deliver CMM more efficiently and effectively. Alternatively, if you are just starting out, reviewing the tool and the items can provide some useful direction in how to set up and structure your CMM practice management. This concludes the presentation. Thank you.